national center for healthcare services, infrastructure, tech, IT, and yet with all of that, those resources and all of that capability, we have, really, really poor public health and community wellness outcomes when you compare us to cities of similar size and economic stratification. We believe all Nashvillians can live a life of health and well-being. But in order to do that, you have to find and address your health disparities, your health inequities. You have to figure out where those hotspots are, where those demographics are, and you have to focus on those areas so that you can get the city overall to have a greater shot at being the city that it should be from a health and wellness standpoint.
I think success for us is really all about health equity and ensuring that every Nashvillian has the opportunity for a healthy life. And I think we're doing that by, establishing and coordinating these really meaningful initiatives that are actually moving the needle on some of the health disparities that are really, contributing to poor health in our city.
NashvilleHealth has been in existence for about 7 years, and over that period of time have had multiple successes. We set out with this whole purpose of lifting every individual up so that they can live a healthier life. And we've accomplished not all of that, but much of that on this journey that we continue today. If you look at several of our programs, one is in our Community Health and Wellbeing Survey, and people have talked a lot about that because it was NashvilleHealth that led pulling partners together across the city, the Metro Health Department, the for-profit hospital systems here, the healthcare community, the 120 nonprofits in healthcare, pulling them together to get a baseline for our community health and well-being. So we did a survey across the city that was representative, every zip code, every ethnic group, every age group, to see what that health is as a baseline. So the Community and Health Wellbeing Survey, published now 3 years ago, just prior to COVID, established a baseline which we hadn't had in Nashville, Tennessee since the very early 2000s.
I'd say another really big success that we've had has been around hypertension. We were really a part of a Target BP project that was statewide, as well as a barbershop project that took place in North Nashville, where barbers, help their patrons take their blood pressure and give them advice. And we really saw that have some meaningful impact in those areas.
There's no other organization in Nashville that is seeking to give the capacity and the resources that, say, a nonprofit community or business can bring to a problem, and pair that with the competency and cultural calibration that a nonprofit or a community-based organization has in vulnerable communities. We want to be a surrogate for both sides so that that resource capacity and their cultural competence and calibration in vulnerable communities can meet each other in the middle.